Médecins Sans Frontières, Doctors Without Borders, (MSF), has raised the alarm over the continued deterioration of the humanitarian situation in Bama area of Borno state despite the presence of government agencies. MSF raised the alarm while urging authorities to urgently provide adequate assistance for the population before the situation further deteriorates. Speaking in Abuja, MSF's representative Katu Lorenz disclosed that newly arrived internally displaced persons (IDPs) in Bama were facing critical humanitarian situation. Lorenz said lack of adequate assistance, including access to shelter and health care, was having severe consequences on young children arriving in the town as IDPs. MSF noted that, since April 2018, more than 10,000 people have arrived in the Government Science Secondary School (GSSS) camp in the town. Many are in poor health. Newly displaced people reported fleeing areas where they were unable to sustain the livelihood, while others reported fleeing areas where the Nigerian armed forces are conducting military operations against armed groups. In GSSS camp, shelter and health care assistance has not kept pace with the growing population, and people continue to arrive every day. Intended for a maximum of 25,000 people, the camp reached capacity at the end of July, and there are not enough shelters for everyone. Well over 6,000 people currently sleep in the open with no protection from the heat, rains and mosquitoes. People do not even have basic utensils to cook the dry food rations, and water is not available in adequate quantities to meet the minimum needs. A lot of children are already in a critical state upon arrival, and poor assistance and access to health care further deteriorate the condition, noting that between 15 August 33 young children died in the camp. MSF said the figure is alarmingly high when put in relation with the total number of children under 5 years old, estimated to be around 6,000. Many children are severely malnourished and suffer from medical complications. They urgently need intensive care and close medical follow-up, as the current rainy season typically sees a spike in the number of patients with malaria and diarrheal diseases. The lack of an inpatient nutrition and pediatric health facility in Bama is having catastrophic consequences for children. At present, the only hospital in Bama, the Bama General Hospital, is not functional. Seriously ill children have to travel to Maiduguri for further treatment. However, many people in Bama cannot afford to pay for private transport to take them to the state capital. And even if they can, inpatient nutritional centers are overwhelmed. In parallel to setting up its inpatient facility in Bama, between 1 and 12 August, MSF had to refer 26 patients to its own pediatric hospital in Maiduguri. Despite the presence of government agencies and international humanitarian organizations in Bama, the health and nutrition situation has been allowed to deteriorate up to the current crisis point. Measures must be urgently taken to avoid overcrowding and ensure dignified living conditions in the GSSS camp. Secondary and emergency health care for both IDPs and the resident population must be scaled up as quickly as possible.